Good morning, everybody bright-eyed and bushy-tailed. Sorry, you folks on the West Coast. It is early there, and I apologize because we've been doing later in the day for you, but Gwen scheduled this one early, so I'm really excited today because we're going to talk about ozone therapy, and it's something that I think should be much more commonplace in veterinary medicine, and so that's why we're talking about it, to see if we can convince some veterinarians and some pet owners to start looking for this sort of therapy. I've actually had ozone injections myself from my naturopath, and I can tell you that it does make a difference, and it's pretty cool. I don't understand it completely, so that's why we have an expert who is going to explain it. So my expert today is Jonathan Lowe, and Jonathan, are you a veterinarian? I can't remember.
I am not a veterinarian. I wish I was at this point. That doesn't help.
But you are an ozone expert. So first of all, give us your background in kind of the ozone world, and then we're going to talk about what ozone is and what it does for us.
Yeah, I knew absolutely nothing about ozone therapy probably about 10 years ago. And since then, it's been a whirlwind. I got connected with, so I was working on the human side, actually, and just got into the integrative world in medicine through a few different avenues, and was working with something called ultraviolet blood irradiation. And then from that, we started to see, man, there's a lot of these ozone therapists around who are like, there's these conferences going on the human side, and there's a lot to do about that, and started to see and learn a little bit more about it. And then I met some really interesting veterinarians. And one of them was somebody you probably have heard of. Her name is Margot Roman, and very fascinating lady, a very dedicated veterinarian, and somebody who was like head over heels about ozone therapy. And I at that point really knew very, very little, and so started to learn myself and realized there's no support for ozone therapy veterinarians in the United States, period. There just was no companies helping to provide equipment, helping to provide protocols, helping to unite these veterinarians and educate and those types of things. And so it was really just individuals here and there doing ozone therapy in their practices, and kind of just cobbling things together. And
that's how things get started.
Yeah, and it shouldn't be that way. And so I started O3 Vets, which is the company that my wife and I now own, and that was in 2013. So not all that long ago. And since then, it's been, like I said, really a huge learning curve for me. But it's been good because I'm somebody who likes to learn. I'm somebody who wants to have answers for people that aren't just, hey, why don't you do this? And so it's been a lot of studying, a lot of digging into studies themselves, going to sources and finding out what's true and what's not, and trying to help these veterinarians really along the path of becoming better ozone therapists. And of course, as we do that, it benefits everybody.
Sure, absolutely. So how many veterinarians do you think are actually using ozone therapy at this point?
Yeah, so in the United States, I would say probably around 300. So not very many when you look at, there's about 80,000 veterinarians total, not that many clinics, but veterinarians. And then worldwide, that's extremely hard to kind of quantify exactly. But there's countries like Brazil, for instance, that has well over 1,000 veterinarians practicing ozone therapy, and then European countries that have it legislated into their health laws and that practice ozone therapy on a much more regular basis, some of them, but still, even in some of those countries, not huge numbers. So, around the world, it's hard to say, but I would say there's probably under 10,000 veterinarians worldwide.
Wow. Is it more commonplace in human medicine, do you think?
Yes,
It is.
certainly.
Okay.
There's over 40 human organizations for ozone therapy. There's thousands and thousands and thousands of human practitioners around the world. 14 countries have it legislated into their health laws, and so that in some countries, that's it's part of medicine now. And unfortunately, in the United States, that's not the case, and that's we're behind on that. It's something I hope changes eventually here. Go figure.
All right. So for those of us whose heads are spinning a little bit, define ozone. What even is ozone?
Yes, that is a great starting point, isn't it? Ozone is a reactive molecule. So if you've when I ask somebody what is ozone, or when you think of ozone, what do you think of? And you guys can chat something in if you want to. But there's usually two places people go, and we'll see if anyone's quick enough to get one of those two. But when I ask that question, well, let me ask it of you, Dr. Morgan. Where does your head go when you hear the word ozone?
Well, for me, it goes to the injections that I've had in the muscles in my back, and that's only because I've had that therapy. But if I hadn't had that therapy, I'd be thinking ozone layer, like, the thing we are destroying with carbon emissions.
Yes. Yeah, Patty says oxygen. Yeah, oxygen is great, but ozone layer, people always are thinking about that. The ozone layer is something we need. It's important, but it's good that it's up there and not down here. And then the other place people go is smog, because they actually measure the level of ozone in smog to be able to tell us how much smog there is in a particular area. And so there's a negative connotation a lot of times with ozone, because and we'll get into this, because it is hazardous to the lungs. You can't breathe it in. So ozone, at the end of the day, though, is a reactive molecule. It's 3 oxygen atoms that have bound together. So if you go outside after a lightning storm, what has happened is you have a smell of ozone, and the reason is you have a very high voltage. Let's say there was a lightning strike, and you have a really high voltage that rips through the troposphere here near the Earth's surface, and when it does that, it rips apart oxygen molecules. And instead of 2 oxygen molecules, you have singlet oxygen molecules out there, and those form back up pretty quickly to O2. But a few of them form back into 3 oxygen molecules, which is ozone, and it's reactive. It's unstable, so we can't really store ozone. That means. So it's hard to bottle it up. Now, there are ways, actually. So like I have like ozonated shampoo and different things. We can actually stabilize ozonides in an oil. So that's different. But as far as ozone gas is concerned, it is a gas. It's blue in color. It smells pungent. It smells kind of like chlorine if you've smelled it before, but stronger. It's a really oxidative product. So in a lot of water treatment plants, they are moving away from chlorine towards ozone, because once it reacts to kill bacteria, it turns back into oxygen. So it reverts very quickly back to oxygen, and there's no byproduct. So that's the beauty of treating water with it, is you don't have any byproduct. It's a natural substance that does no harm to the water. It just purifies it.
Seems like that would be a lot healthier choice.
It is a lot healthier choice, but it's expensive to do it in a large water treatment plant type setting. And there's maintenance required for some of that stuff. So a number of plants have switched to it, but there's some trade-offs there as far as the cost and stuff.
Sure. Everything has a cost.
It does. Yeah, absolutely.
So interestingly, what you just mentioned is that it kills bacteria. So, my mind immediately goes to, actually it goes to the case that I talked about yesterday on Facebook Live, where this dog has had this horrible infection in its nail bed, which I personally think is a cancer, but they haven't been able to biopsy that out yet. But so the veterinarian made a very poor choice and decided they were going to try to carve out the infection. Bad choice. But it seems to me like using something like ozone therapy on an area like that would be not harmful and potentially extremely beneficial to kill the bacteria in that area.
Yes, absolutely. And let me talk about that. But I want to make sure, I saw somebody commented that it's a little muffled on my side. And I want to see if that's true just for that person or if everybody can hear me okay. I can switch microphones if necessary to something else. But just chat it in if you're having trouble hearing. Otherwise, we'll just continue on. So to answer that question, it is a very potent disinfectant antimicrobial. And so good to hear it. Sounds well. That's a very big part of it. But here's the rub there. So it is a really strong antimicrobial. But what's happened with the FDA, and because of how it works as an antimicrobial, is that they've taken this stance on ozone therapy, unfortunately, for human medicine. Which is basically just viewing it as an antimicrobial. And that's really not how it works when we talk about infusing it into the body in a systemic treatment. It's not working as an antimicrobial. When we apply it topically, it is. So when you're dealing with a situation that's maybe a non-healing wound or an ulcer or a hot spot or any type of, external just healing process after surgery, et cetera, ozone can be a very strong antimicrobial that actually helps the body heal as well by calling growth factors to that area and allowing that extra cellular healing matrix to form and just help granulize the tissue, et cetera. So there's some really great ways it works there. But when you go look at the FDA statement, they say it would have to be infused into the body in much larger amounts than can be tolerated to kill bacteria, and so it's unsafe. Well, that's not the premise by which it's working in the body, and that's been proven through thousands of studies and papers and articles that have been written by the scientific community, and yet there they are saying the same thing they said in the 70s.
Yeah, well, getting the FDA to change their mind on anything, as I've discovered with phone calls with them, no, if you don't have 1 million deaths, forget it. That's not enough. So, whatever.
Yeah, and you mentioned fungal, and people are asking about yeast, and so yes, there's a multitude of different pathogens that can be destroyed, gotten rid of by ozone, bacteria, various viruses, yeast. Molds. They use it to actually for houses in the industrial sense to actually reduce pathogen load in a house and to kill mold and other types of things. All of those things are going to be oxidized basically by ozone. And when we're talking internally, though, in the body, the way in which it's working to help eliminate, let's say, pathogens internally is more through activating the immune system than it is through direct oxidation.
Okay. So how is it, obviously it can be applied topically. So is it in a liquid form? Is it a gel form? Like, how are we applying it topically?
Yes. So I mentioned, certain products. So like for this one, this is like an ear oil. So it's in a pretty fluid form in an oil, and in that oil form you can apply it topically to, well, in this case the ears, but also to the skin for different types of infections. That's possible, and then you can actually ozonate a fluid. That's another way you can do it. So you can take saline or distilled water are the best ones to do. And you can put them in a special bubbler. It's like a glass bubbler, we call it. And you actually have an ozone generator that sits next to that. And you generate ozone, and that ozone flows into the water, and it just kind of percolates and bubbles through that water for a period of time. And as that happens, 5-10 minutes later, you have a fully saturated fluid. Now, the fluid won't last very long, you've got about a 45-minute half-life. So every 45 minutes, it reduces its potency by half, unless you store it in a cool place, like a refrigerator. Then you can prolong that. But you can do it topically through a fluid then, in lavage an area, wash it. So in surgeries, they'll use it that way. In homes, a lot of times they'll use it that way. In fact, I was doing it on my dog yesterday at our house and doing a little demo video on how to do that. And so that's another way to do it topically. And the third way is actually through the gaseous form. So we can actually do something called limb bagging, where we'll put a paw into a special bag, and we'll run ozone gas into that bag, and we'll let it just sit there. And it's a great way to treat anything that's resistant to antibiotics. Man, there's been some really cool, really neat cases and studies done on using limb bagging. So that's another way to do it. There's so many. There's 14, 15 different ways to apply ozone. A number of them external, like we just discussed, and then a number of those are internal applications as well.
So let's talk about some of the internal applications that it would be used for.
Yeah, so I think the best way to understand it. So let's back up and talk about ozone a little bit from a high level view. So when you understand how it works, kind of, then you can say, okay, I might be able to use it for this or this or this, and you can connect the dots a little bit better. So I like to start with the idea that really inflammation is the primary culprit that we're going after, indication that we're treating when we're talking about ozone therapy. And especially when we're talking about a systemic method of application. So there's lots of different diseases that have as their root inflammation, where the body is not properly regulating immune cells, and where there's excessive inflammation taking place. Cancer is just one of them, but that's probably one of the primary ones, that we think about and jump to. There's a lot of autoimmune conditions that have inflammation at the root. There's arthritis, of course, that has that. And they're finding out more and more about the role inflammation and oxidative stress have on a pet and on a person. So you might, and I'll include oxidative stress there, because basically what happens is if you go to the store, you grab a box of cereal, and it says, it has this and this and this and all these antioxidants, right, in it. Very quickly, we get this narrative that antioxidants are good. Well, they are good, but oxidation also is good, right? If you stop breathing for a second, you're not going to be drawing in oxygen into your system. And we all know that within a minute or two, if you don't have oxygen, you die. And so obviously, antioxidants and oxidation are two sides to the same coin, and it's very important that we have the right number of antioxidants in our system, things like omega-3 and omega-6 and vitamin C and all these different vitamins, and a big, huge one is glutathione. Glutathione is one of the most important free radical scavengers in our body. And I'm going into science, but it basically helps our system to maintain this homeostasis, this balance, where your body is not going to be overrun by all of these free radicals and these oxidative products that can destroy our cells. But it can do the job they're intended to do. And a lot of these molecules, like hydrogen peroxide, actually is produced in our body. And that's what's called a redox molecule. It helps signal to other immune cells to do their job at the right time. And what ozone does is it actually helps correct a state within our body so that this signaling and this communication can happen properly. When we have a lot of inflammation or oxidative stress in our body is not, it's hampered. It's like suppressed. And this signaling, which is crucial for telling immune cells what to do and when to do it, is suppressed. And what they've been able to show is that when we actually administer ozone internally, you can help that signaling process get basically unmired and help it do its job how it's supposed to do it. And that can correct a whole host of things. There can be so many things that are corrected and helped in that, as we infuse ozone and as we use ozone in the way that it should be used as a medicinal, basically as a drug, but as one that is natural.
So how is it administered? Are we injecting? Are we drinking? Yeah. Are we infusing rectally? Like, how are we getting this in the body?
Yeah, so yeah, you use ozone gas a lot of times, and the easiest way to do it at home is to do rectal insufflation, which is basically just infusing some ozone gas into the rectum with a rectal catheter syringe. Very easy, very well tolerated. There's other ways to do it too. Usually not at home when we talk about systemic methods. So in a clinic, they'll withdraw blood, they'll infuse it with ozone. Sometimes they'll use the ultraviolet treatment we do as well alongside of that, and then put that blood that's been treated by ultraviolet light and ozone back into the vein. Sometimes it's just ozone by itself. And then there's injections. So you mentioned injections. We can actually take ozone gas and inject it around into a joint. Sometimes actually paralysis and different things that happen with degenerative joints. That's been a fantastic condition that's been treated with ozone, injecting ozone gas directly around those areas, along with sometimes platelet-rich plasma or prolo therapy. Some of those things can be injected at the same time. So there's that with the blood. There's subcutaneous ozonated saline. That's a systemic way to administer ozone as well.
Can it be used with stem cell therapy?
Yes, if it's done before the stem cells are introduced. So you don't want to put the ozone in after the stem cells because it can deactivate them. But once the ozone kind of hits the tissue, it's sucked up, it's absorbed, it goes and does its job. And so it can't react with anything else at that point.
Very cool. Are there cases where it's contraindicated, where you wouldn't want to use ozone?
Yeah, the one area where you have to take caution, proceed with caution, that we're aware of to this point is a bleeding disorder. So if an animal has trouble creating and maintaining, clotting or platelets, then the ozone is going to make the blood flow better. So if you've already got a problem with that, where they bleed easily, then you want to be careful using ozone. It's not contraindicated per se. It's just an area where we start a little bit more cautiously. Maybe we don't draw blood in those cases. We do like rectal insufflation. So, yeah.
And so, should this, and I know I shouldn't generalize, but would ozone therapy have a place in any cancer therapy?
Absolutely, without question. In fact, I have a few integrative. There's only 4 integrative oncologists I know of in the United States, and we work with 2 of them. And ozone therapy is a big part of what they're doing for their practices. And not only that, there's obviously many general practitioners who are utilizing ozone on their cancer cases. I had a veterinarian who gave me, we've got lots of stories, lots of testimonies about cancer. This is just one that I thought was really cool, that he told us about a cardiac cancer that had metastasized to the lungs and was just, this dog was dead. And usually in these types of cases, what you have is you have them throwing the kitchen sink at it, right? So somebody comes in with a case like this where they think, okay, we might as well try all these things. And you don't really know what does what, right? And so is it the ozone? Is it something else that happened? Well, they treated this particular pet every day for a week with the ozone and UBI. And they had had it diagnosed. They had had a MRI done, X-rayed and stuff beforehand, and then did this for a week, and then a few treatments every week for the next couple of weeks. Went and brought it to a specialist at A&M, Texas A&M, and they couldn't find any cancer in the dog. And all they decided to do was the ozone and UBI. And it was just an incredible story. And he said, after that, we use it on all our cancer cases.
Yeah, no kidding. No kidding.
So there's those really miracle cures that we can point to and say, yeah, it does something. It does something sometimes spectacular. Sometimes it doesn't do anything. And I wish I didn't have to say that, but I do. We all realize there's times at which medicines don't work for whatever reason for particular pets in a particular stage of the disease. And so, that's just the case, but we do know it works both through studies that have been done on cancer and are available on PubMed and other places, and also through anecdotal stories like the one I just told.
Very cool. So a couple people have said, what would be the best application for oral lesions? Like I'm thinking, we get these cats with the stomatitis. We actually get a eosinophilic stomatitis in some dogs. Would applying like a topical gel, would we be better off doing a systemic treatment for something like that? Can we use something locally?
Yeah. So worse, like if you have no other option, you can use something locally. And that might be an ozonated fluid if you have a little ozone generator at home. I tell people, this is, obviously I have an interest in this and it's my business, but I also do the same thing myself because I believe in it and I see the results. And that is, investing in ozone therapy equipment for home costs a little less than $1,000, so maybe $800. You might pay that in a couple vet visits if you're going to a specialist, or even not a specialist. Sometimes it depends on where you're at, and this can be a tool that's utilized for years and years to come on people and their pets. You didn't hear the people part from me, but at least the pets, and there's ways you can use it then at home under the care and guidance of a veterinarian.
Sure.
And we
under the care and guidance of your veterinarian who has no clue what you're talking about, but it's okay.
Yeah, well, we'll help with that. But yeah, there's local, like this is an oral product that has ozonated oil as the active ingredient. That can be applied topically. It can be purchased. It's easy to use. That's not ideal when we're talking like stomatitis or other infections. Now, some people swear by it and it can help immensely. But we always recommend, if this is a chronic issue, if it's something that's a little more deep-seated, that there be a systemic method of application. So maybe you're doing rectal insufflation, maybe you're doing major autohemotherapy, as well as an oral flush with ozonated fluids or an oral topical gel.
Okay. So you mentioned a home machine that people can get and use it. Do you have, so your company, from what I understand, has multiple levels or multiple types of machines, from veterinary use to home use. Do you have protocols? Like if somebody said, hey, I want to use this at home for my animal for arthritis, do you have protocols written up for different applications, or how would somebody know how to use it?
Yeah, just wing it. No, I'm kidding. So yeah, we do, and we have both we have a treatment guide, which is just a pretty simple recipe book for how to do things and dosing, and then we also have videos on how to do them as well. Most of those are available on our YouTube channel, youtube.com/O3vets. But then when somebody buys equipment, then we have this kind of like a special video library that we open up to them to be able to access that type of thing. And then, as I mentioned, it's always important to have a veterinarian who's prescribing this. We can't do that. People can choose to treat their own animals if they want, but we can only go so far in the support that we give, and we can give recommendations and stuff. But you have to. We highly recommend having a veterinarian on board, even if it's remote, who can help give some guidance.
Yeah, remote would be fine because, like you said, there's 300 veterinarians who are using Ozone in their practices, so you may not have anybody within a reasonable distance who knows anything about it and can give you any guidance. Where are these available for people to purchase?
Yeah, so all of our stuff is on o3vets.com.
O3vets.com.
o3vets.com for that. And at this point, we're the only company that provides this stuff for animal use. There's other companies you can go get Ozone equipment from, but you know what happens when they do that is we get calls from these people saying, so I have this stuff, can you help me figure out how to use it? And I'm not as happy about doing that. We still do help them, but we provide training and support and guidance that is crucial for people to do this by themselves at home or even under the guidance of a vet.
How difficult is the machine to work?
Well, the machine that most people get has an on and off button.
That's it.
So if you can press an on and off button, you should be able to figure it out. Now, there's a little more to that. I'm being a little bit simplistic. So you have to have oxygen that's connected to the generator, and the oxygen has a dial on the regulator, which you can set to like 1/8 of a liter per minute or 1/4 of a liter per minute. And based on that, the concentration of ozone that you're drawing up into your syringe that you're going to use to put rectally into your pet. But it's really pretty simple. We do with people who buy stuff, we give them a free 1-hour live consultation like this on Zoom and walk them through once they get their equipment. Okay, do you understand this? Do you understand? Now they have access to videos, but I tell you what, a lot of times, even with that, people want somebody to come help them, live and in person, ask their own questions, all that stuff. So
sure. Yeah, I mean that training is invaluable. Let me tell you.
Yep.
And having a resource to go to when you're like, crap, did I screw up? I don't know what I'm doing here. So you said it can't be. All right, I have a couple questions.
Yeah.
All right. So to generate the oxygen, you said it's hooked up to an oxygen source. Are we using an oxygen concentrator? Are we using an oxygen tank? What are we using to get the oxygen?
Yeah, an oxygen tank. And so what's necessary is to have your ozone generator and an oxygen tank that has a medical grade oxygen that's going to be the feed for that generator. So most of the time, the best way to do that is to Google medical oxygen near me. And there's suppliers usually around people. I've never had a case where we can't find it, that they can get oxygen from, because we can't ship oxygen actually.
Right. Don't they need a prescription to get the oxygen?
So you need a prescription if you're going to go the medical oxygen route. Now, there is a kind of a roundabout way to do it, which is totally fine, which is actually just getting an industrial tank. Now, in the industrial tank, they still put the same grade oxygen. It's just that they don't validate the tank purity in the same way they do when they give it to somebody for breathing purposes. So, that's a little different, but you can go either way with the industrial one. You don't need a prescription. Okay. I like to, if people can, if they have a veterinarian who's working with them, I like to encourage them to just go the medical route. It's actually usually a little cheaper, to be honest. and it's just best practice, so to speak.
How, and obviously it depends on how often you're doing treatments, but how often are they having to replace that oxygen?
Yeah, it really varies. If you're just doing rectal insufflation, it might be 6 months.
Oh, okay.
If you're doing a lot of ozonating of fluids, it might be a month or two that you need to refill it. The way I do it, I had a medical oxygen tank, and the company just comes whenever I needed. They're in the area every week and trade the tank out, and it's like $15, every time. So
yeah, I mean, that's
really
what we do at the
easy.
vet hospital. That they just show up and trade out tanks. So
yeah.
Interesting. Okay, and then so you said that you're not supposed to inhale it, so it's dangerous to the lungs if we breathe it in.
Right.
Is there ever any danger, like when you're using the machine and you're producing? Because somebody said they got a human machine and it said to take animals out of the house when you're using it. Well, clearly we want to use it on the animals.
Okay, so what they were probably referring to, and I don't know, but was a machine that's intended for whole room air purification, basically. And there's ozone generators that are intended to put ozone in the air. And those ones, you do have to leave the room. Not only animals, but people too. But if you're using a medical ozone generator, we're not generating ozone that's intended to be just let off out into the air so that we can breathe it. So I'm not sure what their particular scenarios. I would guess it was the former.
Right.
Because any medical generator, you could generate ozone in it from our machine and let it off into the air, but that's not the purpose. You always want to avoid that. If you breathe some ozone, we're all breathing ozone in every day in little amounts. It's just high concentrations over long periods of time can eventually, because our lungs don't have the antioxidants that our other tissue do, can actually damage our lungs. So we want to be careful of that. It's not something people have to freak out about. Sometimes you get those people like, I just breathe out, I smell ozone, I breathe out. Am I gonna die? Am I dying right now? That type of thing. And you don't have to, worry about it quite that much.
Okay. So Michelle Allen has the same question I do. So we have, she and I both have portable oxygen concentrators because we use them to hook to our ICU oxygen cage. Would you be able to use that to generate the oxygen for this?
Okay, so I would be comfortable doing that to ozonated fluid, something like that. You get about 93 to 95% oxygen when you use a concentrator. And so it's not pure oxygen. So you could be producing a little bit of a secondary gas in there as well when you're using those. They do use those in some European countries, actually, to do ozone therapy. In general, it's kind of frowned upon. Like, it's not the best way we could do it. I don't think it's dangerous at all. It doesn't seem to be any literature that points to it is dangerous, or, I think when you're ozonating a fluid or something like that, you use a lot more oxygen. So it may make sense to use an oxygen concentrator to do that in larger volumes in particular. I would be very comfortable with that if I had one, to use it that way. But in general, they're not used. When you do use an oxygen concentrator, realize that the concentration of ozone you get is not what your generator says you'll get. So because we're using a lower grade oxygen, it's going to reduce the concentration of ozone that we're producing as well. And also, so some devices, some generators can't support the use of a oxygen concentrator. It has to do with the pressure they put out and all that.
Okay, interesting.
Yeah.
That would be one of those where I'd be on the phone going, okay, this is what I got. Can you help me make this work? Yeah. Pretty cool. So we've talked about doing the rectal insufflation, and I know Margot Roman does a lot of fecal transplants as well. So is this something you would use along with a fecal transplant, or are they two separate procedures that you would do?
Yeah, there's really, okay, so I'll address that. There's really no other modality that I'm aware of that you can't use it alongside of. Margot, with fecal transplants, has told me many times, I really believe that my success rate with fecal transplants is only due to the fact that I'm using ozone first to break up the biofilms in this area, in the colon, in the rectum, before I do my fecal transplant, so that it really takes. And so that's her protocol is different than different protocols that are out there. And she uses ozone, and her success rates better than a lot of the other people who use fecal transplants as well. And that's what she says is the reason.
How far apart would you be doing those two treatments? Would you do the ozone one day and the transplant the next? Do you do them right in succession, or do we need to allow the ozone to work first?
Good question, and I'll reply to that along with the same idea with stem cells. Stem cells and even vitamin C, high vitamin C treatment. Yeah, maybe you didn't like the question. I don't know, but is you do them pretty quick. So you'll do ozone therapy typically first, because again, ozone is a reactive gas, and if you're putting something else in with it, it could potentially deactivate or change the way in which that particular product works. So we want to put ozone in first, let it get absorbed. It turns into ozonides, which aren't nearly as reactive as the ozone itself. And then those are, spread around the body. And then you would do your fecal transplant pretty much right after that. So, and on this issue, some people are doing antioxidant treatments, like high vitamin C treatment. It's an antioxidant, right? And they're doing it, and they ask, can I do that in conjunction with ozone? And the answer is yes, as long as you, again, do the ozone first, let it be absorbed. Because actually the ozone a lot of times is actually creating antioxidants in your body. It's like a little oxidative stress that initiates this response in the body. And your body starts to create oxidize glutathione and do other things that create antioxidants. So they're not contraindicated. They're not, hurting each other. It's done properly.
Very cool. Very cool. So, how do we get more veterinarians to know about this? Do you go to like now that we're getting back in person to things, do you go to AHVMA, some of the veterinary meetings to try to get more people aware of what you're doing?
Yeah, we do. It's hard. There's a lot of resistance, not in the holistic community per se, but just in general. It takes a lot of education. And so we do go to that. We have a yearly summit for veterinarians, veterinary ozone therapy summit that we do. And this year, we're actually doing one for pet owners. So we're going to have something this summer that will be geared towards ozone therapy for pet owners. So that would be a great place to learn more.
Is that going to be an online summit or in person?
Well, it's just going to be virtual.
Okay.
I'd love to do something on site, but it's just too expensive. And, with something like this, people don't know about it.
So when you're ready to do that pet one, make sure that we know about it, because we will definitely put that out there and try to get more people
That would be great. I'll send you the information as soon as we have it available.
Yeah, one of the problems that we're seeing in the veterinary world in general is that we don't have enough veterinarians. People are waiting months to get an appointment, even for something routine. And really frankly, if you have a sick animal, I wanted my dog to see the cardiologist because he's got a murmur. He's an old dog, and it's a 6-month wait to get into a cardiologist. So what we're trying to do is, first of all, educate people so that you know when you have a true emergency and when you don't, but also things that we can do at home, ways that we can help ourselves, help our pets. Because it can be so, first of all, if there's only 300 veterinarians in the country who are even talking about this or doing it, good luck finding one. If you happen to be near Margot Roman up in Massachusetts, you're in good shape. And we're actually interviewing one from Colorado, I think, at our summit. So there's a few out there. But they can be very difficult to find. It could be, hours of driving, and could be a long wait to even get in to see people. So things that we can empower people to be able to do something at home, and then have that support from you guys with, answering questions, videos, knowing how to do things, I think is critical. So I think that summit would be amazing. And I would bet that at least half the people that are watching us today would be right there ready to roll with that. So, all right, so it's o3vets.com, right?
Yes. Yep.
Awesome. So, Jonathan, you are a wealth of information, and it's like everybody in the pet space who gets really passionate about something. It's like we see a need, and then once you dive down that wormhole, you can't get back out.
I know it's dangerous, isn't it?
It is, but I really appreciate what you're doing, and I really appreciate you taking the time to come talk to us about it. We could sit here and ask you questions, I think, for about the next 7 days, but we're not going to do that. I'm going to respect your time. So everybody, please check out o3vets.com. I think that there's a ton of information, and you can look at the units if it's something that you're interested in. I don't know, maybe if you have a couple of friends who would also like to use it that are close by, maybe you can go in together. And frankly, I don't think the price tag is bad, particularly with the fact that you get backup support and videos and ways to use it. And maybe, just maybe, you'll convince your veterinarian that this is something really cool that they should be doing. This is how veterinarians learn, frankly. When I was in practice, clients would come in and teach me all kinds of things. Like I found about some herbal remedies, homeopathic remedies, different treatments that people were doing that I was like, what do you? So if you have an open-minded veterinarian, teaching them some of these things, opening that window a little bit for them, give them the website, say, hey, this might be something that, get them through their bottom line. If you say, hey, you can actually charge for this, it'll be great. You'll be the only one in the neighborhood doing it. That's how you get them turned on.
Yeah, absolutely. And, I appreciate you having me on. I appreciate the support because to be frank, we're a small company, and even just being able to be in front of people who could benefit from this is a big deal for me. And I appreciate you, Dr. Judy, doing that. I'm
glad you reached out to me. It was so funny. I don't know, maybe 6 months ago, we were talking about different experts we wanted to get on for summits and stuff. And somebody said in our feed that they wanted to learn more about ozone therapy. So then it was sort of like, all right, now we got to find somebody who knows anything about ozone.
Yeah.
So we appreciate you being willing to educate us. So everyone have a wonderful day. Jonathan, enjoy the rest of your day, your weekend. You may get inundated after this, which would be fine.
That would be fine. And I tell you what, I'll send you a special code for your listeners that'll give them a discount if anyone's interested.
Okie dokie. So stay tuned, folks. We will get that posted for you.